So which is the ideal patient for deep brain stimulation? Well, I think this depends on the disease that we're considering. I think it's very effective therapy. It's also not what I think, but what the literature has demonstrated, and my experience with patients. Very effective therapy for patients with severe tremor disorders, and particularly here I'm talking about essential tremor, where it's highly effective therapy, often where drugs have failed, and where the patient's life is a misery because of very severe tremor. So such a patient with severe essential tremor would be an ideal candidate for this form of therapy. The other disease that I mentioned, primary torsion dystonia, or even other forms of dystonia, respond very well to deep brain stimulation. Some types of dystonia, which we call symptomatic dystonia, where the dystonia is due to some other disorder of the brain, such as after a stroke or some injury to the brain, patients with those kinds of dystonias don't always respond so well. And then the biggest group of patients that we treat in movement disorders are, I would say, patients with Parkinson's disease. So who is the ideal patient? Well, I think it should be considered in anybody with advanced disease. And what I mean by that is a person who has Parkinson's disease, who has been treated for a while very effectively, but then as the disease progresses, is starting to have trouble with their medication. For example, the medicine is wearing off, its effects are unpredictable, or there are severe involuntary movements induced by some of the anti-Parkinson treatments, or the drug doses have become very high and are causing side effects from medication. There is another group of patients with Parkinson's disease who have predominantly shaking or tremor, in whom medicine is not very effective, and deep brain stimulation can be a very effective treatment for this kind of tremor. Ideally, the patient should be younger because the surgical risks in the younger patient are much less than in the older patient. But having said that, there is no upper limit really on age. Age as a number. Age as a person's chronological age is more important. I think a patient who understands what deep brain stimulation is all about, who has good social supports, such as a supportive family or friends, to help them through the post-operative phase and in the psychological preparation for surgery is an ideal patient.